Dr Bennett is with us. She's the Chair of Epidemiology at Deakin University. Appreciate your time. What did you make of that hike in the numbers today? How much of a concern is it?
Well, that's the trouble with daily counts. They can jump around depending on which cases are followed up and how many contacts they have. So you can discover, an outbreak within those daily numbers. So I don't think we should be alarmed. The average number over the last 3 days is more important than today's number itself, and that is still tracking not just in with the rises we've seen lately. This is actually looking a bit like we are seeing that plateau. So hopefully people won't be put off by today's numbers. Watch what happens over the rest of the week, but hopefully we will see this continual trend to a flattening. So we might see high numbers again tomorrow. They might drop the next day, but as long as our overall average stays where it's been, which is around 1,800 cases, then we should start to see this turnaround as well. So that's what we're hoping, that this is really just one of those spikes we do see. We saw it in Sydney when they were plateauing. You'd have a high day, maybe two, and then it would come back down again. So that's the message. Watch the longer term trend.
So you don't think the numbers we're seeing at this point would put that reopening plan, the end of lockdown, in peril?
No, I don't think so. And really, the plan's based on our vaccination rates, and they continue to climb. That not only helps us try and contain these case numbers, but importantly, it's stopping the number of cases that are ending up in hospital. So, in fact, if you see where we are compared to the Burnett plan, which is what the health department and state government have used in Victoria and New South Wales to plan these exit strategies, we are way below the anticipated hospitalisation numbers. They thought, as our case numbers were approaching the numbers we have now, that we would see nearly 3 times the number of cases, and we're not seeing that, which is fantastic. So the fact that we have less people who are seriously ill, there's a manageable load on our ICU departments that is well within what was anticipated at this stage of the pandemic for Victoria, or this outbreak, then that bodes well for us continuing with the plan. So case numbers will bounce around. Hospitalisations are staying reasonably steady at this stage and well below those predictions.
Catherine, what's your analysis of the situation in New South Wales at the moment?
It's still looking good. We won't really know what the impact is of these relaxed restrictions until the end of the week. Again, it's hard to read your daily numbers. You've got to look at those averages. But it'll take a week or more before we start to see any impact on cases of this opening up. So again, watching the trends is really important, and particularly hospitalisations. That will again guide New South Wales as that heads towards its next steps as it approaches 80% fully vaccinated.
And when we look at the vaccination snapshot across the country, are you confident that we will continue to see it sort of going along at pace, or are you concerned, as some experts are, that when we do reach that top level of people who haven't quite got there, that things will start to drop off?
Yeah, we will always see a tapering once you get over 90%. Victoria is very nearly at 90% for a single dose over 16, and New South Wales already over. So we don't expect to see that continue to climb at the same rate. But you're right, the concern is not just the overall state average, as high as it's going to be, when we hit 90% double dose. It's also making sure we don't have parts of the community with very low rates. That's where we have to then manage disease risk in a different way. So while infection risk at a population level starts to drop, and even the risk of infection and spread of the virus, you can still have parts of the community with lower rates, which leaves them vulnerable. So all the states and territories are now looking at that to really understand where there might be populations still at risk, to work with those populations about vaccination, or a plan going ahead for how you manage infections in those communities if vaccination rates stay low.
Catherine Bennett, we always appreciate you taking the time to join us. Thank you.
Thanks, Ash.